Okay, good afternoon, everyone. I see everyone is coming in. We welcome you. Thank you so much for your support. We are just waiting for a few more of you. And as you go filing in, we welcome you again. We're also grateful for your support. As you know, this Zoom meeting, this presentation is a multinational one because here we have persons from all over the Caribbean, especially the countries Curacao, Haiti, Jamaica, of course, the United States, and we welcome you. If you are here as a family member or here as a friend, again, we welcome you. So in the meantime, while we wait a bit, we wait to begin. Get your questions ready. If you do have them, I hope that we explain everything well. So, you won't have any questions, but in the meantime, you can get those questions ready. Sit back, relax. We are almost ready to begin. We also have an announcement for our French speakers. I'm going to ask my team member, Shella, to translate what I'm saying to our French speakers. At a particular moment, we are going to, those that speak French, we are going to change to another room. If you speak English, then you stay in this Zoom. If you speak French, we're going to go to another room. I'm going to allow my teammate to translate that for me.
Ok, moun qui parle créole yo avec français yo, nous allons changer de Zoom parce que bon petit problème qu'il a. Donc, avec ça n'a changé Zoom. Donc, on va envoyer le lien bas nous dans chat.
Okay. Thank you so much, Shella.
Okay.
While we begin, I'm going to ask my team members, and we still are waiting for everyone to come in. I'm going to ask my team members to introduce themselves so everyone can get to know. Well, if you came for a particular person, you already know them. But if you don't know them, we're going to introduce our team members. Shella? Let me. Ay, tu micrófono está apagado. So with us, we have Metushala Bartolome. She is going to introduce herself a little later. I'm going to ask my team members to open their cameras at the moment as well so that everyone can, get to know the rest of the team members. If you could introduce yourself as well, that would be perfect. For those who do not know, my name is Olivia Valentine, and I'm a representative for this SICEL Health Intervention Program from Jamaica. And so I welcome all the Jamaicans in the house, as well as the non-Jamaicans. Tiara?
Good afternoon, everyone. My name is Tiara Yosefia. I'll be a representative from Curacao, and welcome. Thank you for coming as well.
Benjamin?
Good afternoon, everybody. My name is Benjamin Brutus, and I'll be a representative from the United States.
Okay, Mr. Dennis Wesley. En francés, obvio.
En inglés. Good afternoon. My name is Wesley Dennis. I am here for present a disease that calls sickle cell disease.
Okay, thank you so much. And my other classmate, Metushala, she should be here. I'm not sure if she's having a bit of an internet problem.
Yeah, está aquí.
Okay. Shella, si puedes introducirse, por favor.
Okay. Bonsoir tout le monde, je suis Metushala Barthelemy. Je viens d'Haïti.
Okay, thank you. Okay, since everyone is here, we are going to begin. Thank you again. Metushala, ella va a traducir por los que hablan francés. So, así estamos listos, Shella. Tu cámara está apagada. Ok, listo. Ok, vamos a empezar. Como dijimos a todos, soy Olivia Valentine y hoy vamos a presentar este programa de intervención. Oh, I forgot I'm speaking Spanish. Hello, my name is Olivia Valentine, and today we're going to start this intervention program for the class Health Lifestyles.
Bonsoir tout le monde. Compagnie, c'est Olivia Valentine. Moi, c'est Métiché Laboratory. Donc, nous allons présenter un programme d'intervention pour les gens qui ont anémie falciforme pour une classe qui relaie éducation sur la santé.
Okay, and we're going to start. As we mentioned, it is in fulfillment of the course Lifestyle Intervention Health Education. Okay.
Yeah, comme on te dit déjà que petit programme c'est programme d'intervention sur l'anémie falciforme ou bien drépanocytose et pour classe n'a fait là l'éducation sur la santé.
Okay. All right, these are the topics that we're going to be talking about in this health intervention. First of all, the definition.
De ça nous allons parler aujourd'hui. Premièrement, nous allons parler de définition maladie.
The epidemiology and etiology, which means who is most affected and what is the cause of the disease.
Nous allons parler de épidémiologie maladie et de étiologie qui cause maladie ça.
Okay, the symptoms and the diagnosis. How do I know I have it?
There is something more than just the policies.
We're going to ask everyone to turn off their microphones at this point, except for
Deslen. OK. Et après, nous allons parler de symptômes maladie ça qu'a gagné et comment on a fait diagnostic maladie ça.
Okay, we're going to speak about the management of complications. How do we treat it? And also the prevention and the impact of the disease.
OK, et après nous allons parler de complications que maladie ça qu'a gagné et comment nous peut prévenir et qui impact maladie ça gagné sur la vie monio quotidiennement.
Okay. As we continue, the question is, why should I even care about sickle cell? Why does it matter?
OK, première question pour nous poser peut-être que ça doit préoccuper si moi gagne comme si on monde qui gagne anémie falciforme.
Okay, one, because it is a genetic disease, it's of genetic origin, and it largely affects those of us who are here in this room. I know maybe we have not paid attention, but most of us are of African descent. While we continue, it also has no cure. The disease has no cure, and it is associated with life-threatening complications. The life expectancy is pretty short, even though we know that, God is in control. Persons with sickle cell normally live between 20 to 30 years. And even though we are most affected, somehow there's a lack of knowledge within the community that is most affected. And this is why we should care. I don't know if Shella is still with us. Shella, ¿estás con nosotros? Okay, mientras que ella regresa. Okay, as we continue, what is the objective of this program? Why are we even doing this program? One, as we mentioned, we are doing this for a class. However, as medical professionals in training, what we would like to do is directly impact our communities right where we are. We're starting right now. We don't want to wait until we cross that stage, right? Also, to increase awareness of the disease that affects us. It affects us, so we need to be here. We need to know about something that affects us and also know about the preventive methods that are available. And so on behalf of all of us from the SciCell program, Tiara from Curacao, Dennis and Shella from Haiti, myself from Jamaica, and Benjamin from the United States, we welcome you all to the SciCell program. And we welcome all your comments and questions as the program continues. At this moment, what we're going to do, no sé si Sheila todavía está con nosotros, what we're going to do.
Sí, estoy, ya.
Okay. What we're going to do is that we're going to ask our French speaker, Sheila, si puedes traducir lo que estoy diciendo. We're going to ask our French speakers to move to another Zoom location that will be placed in the chat. The link or the password will be placed in the chat. Those of us who speak French will go to that location. Sheila?
Ok. M'bral voyer un link pour tout le monde qui parle français ou bien avec créole. Parce que nous allons changer de Zoom. Comme je dis, nous avons un petit problème qui fait que nous tous les deux, comme si deux monio pas dans la même Zoom.
Okay, so Sheila, if you could place the Zoom credentials in the group, in the chat, sorry. And so all of us who speak French, we will move to that location at this time. Start. What do you know about sickle cell disease? How much do you know about sickle cell disease? My colleague is going to place the pre-evaluation. So we're going to just see where your mind is. The pre-evaluation is in the chat. If you could please get your phones ready, your computers ready, just click the link and open that link. It takes only 2 minutes. Answer really quickly. How much do you know about sickle cell disease? So we're waiting for you to do that. And as soon as you're finished, let's see in the chat, done. You guys can place done so we know that you are finished. So the link is in the chat. We're gonna see how much we know about sickle cell disease before we begin. There it is in the chat. Please get your phones out, get your laptops out, get your tablet, whatever device. Please get them out. Do this quick evaluation for us, only 2 minutes. And we will see as soon as you're finished. Please place in the chat done so we know that everyone is finished. At this point, we're going to move on. Those of us who are still doing it, we are waiting for you to continue, but we need to move on. The time is going on. I know you guys have a lot of things to do. So we're going to move on at this point. So some of us have already gotten a grade. Some of us haven't yet gotten a grade. Hopefully, as we continue, please don't cheat, but we can learn more and more. Okay, we're going to share our screen once more, and we're going to begin officially. So as we mentioned before, let's just get back to where we were, right? So we wanted to find out how much we knew about sickle cell collectively. To know about the definition, I'm going to turn over to my colleague, Miss Tiara Josephia.
Hi, everyone. Welcome again. Thank you for coming. Can I get the next slide? Today, we're going to talk about what sickle cell disease is. And Miss Larissa Roan, who is an author and a sickle cell survivor, described it as hell. And she says, hell is living with the chronic blood disease, sickle cell. One moment, life is beautiful and all is well. Then in an instant, excruciating pain renders you confused, helpless, unwell. It's my reality, and it's a hard sell, but nevertheless, a reality on which I cannot dwell. Next slide, please. So what is sickle cell disease? The National Institute of Health describes it as an inherited disease in which the red blood cells have an abnormal crescent shape or sickle shape, hence the name sickle cell, that block small blood vessels and do not last as long as normal blood cells, red blood cells would. So about this disease, how does sickle cell come about? Well, for that, I'd like to start by explaining what would happen in a normal healthy body. So our DNA is coded to make these things called amino acids. And these amino acids are chained up to form these things called proteins, and proteins are what make up the cells in our bodies. Now, red blood cells contain this protein called hemoglobin, which is in charge of transporting oxygen from our lungs to the rest of the tissues in our bodies. So hemoglobin, like I said, is a protein that consists of amino acids. And in this very specific place, this protein has an amino acid called glutamatic acid. This would be in a normal healthy individual. Now, what happens in sickle cell? In sickle cell, this one amino acid, where it's supposed to be glutamatic acid, it changes. There's a mutation in the DNA that changes the coding and switches the glutamatic acid for this one amino acid called valine. And you might ask yourself, what does one tiny amino acid change? A lot. Normal red blood cells are very elastic and can find their way through nooks and crannies in very small blood cells. And also, like I said, transport the oxygen from the lungs to the rest of our body. With this one switch of amino acid, it loses the capacity to transport an optimum amount of oxygen to the rest of the tissues in our bodies. And also it loses the elasticity to work its way through these nooks and crannies of the small blood vessels, which cause blockage. Next slide, please. So what are the types of sickle cell disease? There's HBSS, HBSC, and HBS beta thalassemia. Like I said, there's a change in the form of the hemoglobin, and the original hemoglobin is normal hemoglobin. And in sickle cell, there's this change of hemoglobin is now named hemoglobin S. So in normal sickle cell, or in HBSS, you get one S gene from your mother and you get another S gene from your father. So either you get one sickle cell trait from both your parents, or one of your parents already has sickle cell and you get from the other, you only get the trait. This causes a severe form of sickle cell. There's also the HBSC, where you get one S gene from your parent and a C gene, which is a different kind of modified hemoglobin from another parent. And this causes a milder form of sickle cell. And there's also beta thalassemia gene from another parent, which is also a different kind of modified hemoglobin. In the O type, it would cause a severe form of anemia, and in the plus type, it will cause a milder form. And then next slide, please. So in a type SS, in this case, you can see there's AS. A would be a normal gene, and S would be a hemoglobin S type, so a sickle cell gene. So in this case, you need both. You need two genes with sickle cell for your body to express the sickle cell disease. In this case, both parents are they have the trait but don't have the actual disease. So in case where you have a gene with the trait but don't have the actual disease, there's a 1/4 of a chance of your child, a 1 in 4 chance of your child having normal hemoglobin or no sickle cell disease or trait. There's 2/4 or 50% chance of your children having a trait but not the actual sickle cell disease. And there's a 1 in 4 or 25% chance where your child will have sickle cell disease expressed. Next. Now there's also, like I said, there's a hemoglobin C, which is a different kind of modified hemoglobin. If one parent has the hemoglobin C trait and another parent has the sickle cell trait, there's a 1 in 4 chance that your child will have the hemoglobin C trait. There is a 1 in 4 chance that your child will have a sickle cell trait, and there's a 1 in 4 chance where they will have a sickle cell disease expressed, but the SC, which is the milder version. And there's also a 1 in 4 chance that your child is completely healthy and also free of traits. And the last type is also the beta thalassemia type. If one of your parents, if both of your parents have the trait, there's a 1 in 4 chance that your child is completely healthy. There's a 2 in 4 chance that your child has either beta thalassemia, sickle cell beta thalassemia 0 or plus, and there's a 1 in 4 chance that they have both genes and have a severe version of this. Next slide, please. So what to know about this disease? It's genetically recessive disease, which means that you need one gene from both of your parents. It's produced by the hemoglobin S, which is the modified version of the hemoglobin. This mutation lessens the capacity of oxygen transportation, which causes the pain in this disease, and it can cause occlusions of blood vessels because of the loss of elasticity, like I already explained. And the thing about sickle cells is that there is no cure, and the treatment is solely based on improving the quality of life and prevention of complications down the line.
Okay, now we're going to move on to the epidemiology and etiology. Epidemiology and etiology simply mean how many persons are affected, who are most affected, and how the disease works. So we're going to keep moving in that regard. Okay, epidemiology. Most of us already know that sickle cell disease disproportionately affects those of us who are a bit more melanated, right? Those of us who come from, who are of African descent. So that includes not only persons in Africa, but also those in the diaspora. That's the Caribbean, that's South America, especially countries like Brazil, Colombia, Venezuela, with high populations of Afro-descendants, also the United States. But it is not just a quote unquote a Black disease. Many times we say, okay, sickle cell is a Black disease. Let us not forget that while those of African descent have a higher proportion of having the disease, where it has more prevalence in the Black community, those of us who are from the Middle East, as well as other race groups such as Latin Americans, those with Mediterranean descent, also have sickle cell disease in their bloodline. A few stats: 6,400,000 persons are affected by sickle cell disease worldwide. That's a huge number. And this just shows how important sickle cell disease is, because with such a huge number, it's so crazy to think that many of us who are the most affected, we seem to either not have an idea or we don't care. 300 million have the disease trait. So that means we do not have the disease. However, through process of genealogy, speaking about gene processes, we are carriers of the sickle cell gene, and 300,000 are born every year with the disease. Here's just a map of the places that are most affected. So as I mentioned, it's not only just African descendants. Here we're seeing India has a huge prevalence of sickle cell disease. This is the number of newborns born in 2015 with the disease. The United States, Brazil, and of course here we can see that our region, where most of us here are from, has a bit of color as well. A deep brown or deep red stain color, which tells us that from 10,000 to 100,000 persons, 100,000 newborns were born with sickle cell. Okay, I won't spend too much time in the etiology because, as my colleague Tiara told us, we know that it is caused by an abnormality within the hemoglobin. Persons with sickle cell disease have hemoglobin S, which causes the blood cells to change form and cause occlusion in the blood cells when certain conditions become present. That's low oxygen, so there's no air, it's cold. We'll speak later on about how stress and other things can also cause sickle cell crises to occur. Just reiterating, we know about the sickle cell trait, and this is something that we need to put a pin in. I remember a few years ago, I was in high school, and the Southern Regional Health Authority, they did a program trying to increase awareness of sickle cell within high schoolers in my parish, which is Manchester. Those of us who don't know about Jamaica, I'm from Manchester, which is in the south central part of the island. And so the health authority of that region tried to increase awareness. And what they did was that they tested all the fifth formers of the year, fifth formers, to know what our sickle cell trait was. And I remember when the results came, those of us who had the sickle cell trait, many of the other students were in shock, almost like, okay, they have the trait, that means they have the disease, and that is not the case. What the sickle cell trait means is that, right here we can see well illustrated. Think of it as a half and half solution, half and half mix. You have a cake, you cut it in the middle. those of us who know about biology know that we get half our chromosomes from our mom, half from our dad, and this makes a beautiful mix, right? If one of our parents has a sickle cell trait, so let us, right here, if you can see on the illustration, the part that is pink represents the person having a sickle cell trait. Let's think about it as A and S. A being normal, S having the trait. If both parents do not have the disease but have the sickle cell trait, there is a 1 in 4 chance of one of the children having sickle cell disease. 2 of those children may have the trait and 1 may be unaffected, but we know how genealogy is, we know how genes go. It's not a one and done, it can go any way, but this is the way that we can illustrate what the sickle cell trait means. When you have a sickle cell trait, that means that you are, let's put it half-half, local colloquial expression. There you have you may pass on the sickle cell gene to your child, and if your partner also has a sickle cell gene or has sickle cell disease, your child may be affected by sickle cell. So the point of this, people with the trait do not have sickle cell disease. They don't have it. Moving on. This is just another illustration. What are the symptoms that persons with sickle cell disease? And persons with sickle cell disease, right here, we can see them. Both parents, as I mentioned, both parents have to have the trait. So the person will be an SS, meaning fully blown sickle cell disease. What are the symptoms they have? Anemia and frequent infections. Persons with sickle cell disease may always feel weak. They may be pale, they may suffer from jaundice from time to time, they may have swelling of their hands and feet, and the cardinal sign of sickle cell, which is severe pain, episodes of severe excruciating pain. Some other manifestations that someone with sickle cell may have is chronic anemia, as we mentioned, with a hemoglobin concentration of 8. I know hemoglobin is a bit technical, but you know, when someone says they have anemia, or quote unquote, in Jamaica, we like to say the blood is weak. The hemoglobin is the lab test, or the lab standard. The hemoglobin concentration is what we use to measure the concentration of hemoglobin, which is the red substance in our blood. So 8 is very low. The normal should be around 12. So this is very low. Also, acute chest syndrome, where patients suffer from pneumonia or pulmonary infarctions. Necrosis, which is basically a breakdown, infection and breakdown of the bones. Priapism, which refers to sustained erections that are very painful, and also renal failure. How do we diagnose it? When you go to the lab and say, okay, listen, I want to know if I have sickle cell disease or if I have the trait, there are 3 tests that can be done. 1 is diagnostic. 2, only check if you have the trait. The 2 that check if you have the trait or may have the disease include the ML test, and what they do is that they subject your red blood cells, so when they draw the blood, they subject your red blood cells to conditions of low oxygen through chemicals. And so someone who has the trait or potentially may have the sickle cell disease, right here we can see sickling. You can see that the blood cells, they're not circles anymore, they're in a little crescent shape. So we know that, okay, this person may have the sickle cell trait and also may have the sickle cell disease, SS. There's also the Etano test, where they try to polymerize the hemoglobin. So they run some chemical tests, and so when they are finished, those of us who have the sickle cell trait or may have a sickle cell disease, the blood is going to look a bit more turbid, or it's going to be opaque. You can't see through it. As you see here, those of us who are normal, AA, don't have the trait, don't have the disease, you can easily see the lines through the sample. But those of us who have a sickle cell trait or have sickle cell disease, you won't be able to see it. However, these are not diagnostic. You can't go from the lab and say, yes, you know, they did the ML test, they did the Etano test, and so I know I don't have it. No. In order to diagnose sickle cell disease, the electrophoresis test has to be done. So it's a genetic test, and what they do is identify clearly the genetic lines for sickle cell, which is the SS. So it's a definitive diagnosis. I'm going to turn over to my colleague, Benjamin.
Okay, so now we're going to talk about the management and complications of sickle cell disease. So next slide. All right, so how are the symptoms managed? The first thing that patients need to know is that they should avoid triggers that will cause what they call it sickling. Sickling is basically when the severe pain and crises appear within the individuals with sickle cell. So there's different triggers. For example, extreme heat and cold or sudden changes in temperature. The reason behind this is because when you are exposed to a drastic change in temperature, your blood vessels will begin to constrict or dilate depending on the temperature. And that constriction will cause the blood cells to not be able to flow as well. It'll cause the blockage, and in turn it'll cause, the ischemia to wherever it's leading to, and it'll cause the severe pain. High altitude should also be avoided because at high altitudes, there's not as much oxygen, and people with sickle cell are already having issues with transporting oxygen through their body. So basically it adds a more taxing situation to what's going on. Dehydration, if you're dehydrated, you have less fluid and it's therefore less blood flow. Overexertion, and also stress. Next slide. Now, there's various complications that are associated with sickle cell disease, and a majority of them are associated with blockages in the blood vessels of the body. So depending on where this blockage leads to, it could cause a different problem. For example, with stroke, the blockage will lead to the brain. Blindness, the blockages could lead to the blood vessels that are connected to the eye. This in turn will cause eye function deterioration. Leg ulcers can also sporadically appear, as well as organ damage. Acute chest syndrome, as Olivia spoke about before, is another complication that can arise, which basically is like pneumonia and those types of things. Other complications, next slide, is pulmonary hypertension, gallstones, and pregnancy complication. The gallstones arise because the blood cells within the body, the sickle cell blood cells, don't last as long as they normally should. They're constantly being deteriorated. And when they deteriorate, they release this item called, or a substance called bilirubin. Too much bilirubin in the bloodstream then in turn results into gallstones, which can also be another painful complication that can arise. And pregnancy complications. If a mother is pregnant and she has sickle cell disease, there's going to be less oxygen flowing to the baby. And with less oxygen flowing to the baby, it'll cause the baby to have a decreased birth weight, or if it's really severe, the baby can be a miscarriage, it'll be a stillborn, or it can also cause complications for the mother. It could cause her death as well. So you have to be very careful if you're pregnant and you have sickle cell disease to make sure that you're constantly going to the doctor and the doctor is checking you and reviewing you to make sure that everything is going smooth and well. So now we're going to talk about prevention and treatment. So for the prevention, there's not much you could do for prevention of yourself, but prevention for your kids, you can talk to a genetic counselor. The genetic counselor will let you know how much risk you have for passing this gene on to your children, depending on if you or your spouse has the recessive gene. So it's important to talk to them to figure out exactly what is the risk. If only one person has the gene and the other person doesn't, you're completely safe. None of your kids will have sickle cell disease. However, if both of you have the gene, double recessive, or if you're both carriers, there is a possibility that your kids will be born with the disease as well too. So speaking with the genetic counselor will allow you to better select your partner for marriage, or at least know what steps you should take in order to avoid the situation. And next slide. Recommendations would be to know your intentions. If you know that you're a carrier or you have the disease, it's very important to talk to your spouse about it and let them know. It's not saying that you should immediately, cut and run. For example, if you're a carrier and your spouse is a carrier, it doesn't necessarily mean that you have to end the relationship because it's not going to work out. It'd be best to, again, talk to a genetic counselor to at least know the risks and the complications that can arise from deciding to have kids in the future. You also have to be understanding to know how the person might react. Some people might not be as open to dating another person that's a carrier or have the disease because they may not want their children to be born with the same problem. So it's just very important to get tested and to know your genotype in order to make decisions for the future. And for the treatment, next slide. There is a way to cure sickle cell. It's through a stem cell transplant. However, it's not commonly used because of all of the complications that can arise from it. The main risk that comes with it is graft versus host disease, basically where the body and the cells that are transplanted don't get along, they attack each other, and it can often be life-threatening, which is why stem cell plant transplant is typically only used in children who have severe symptoms and there's no signs of getting better. That's when they will go to that choice. However, typically speaking, treatment is to manage the pain that comes with the disease. So there's various different medications that are used. For example, hydroxyurea, L-glutamine oral powder, pain relieving medications such as regular Tylenol or paracetamol, or non-steroidal anti-inflammatory drugs, as well as crizanlizumab and voxelotor. A majority of those medications, again, are used to treat the pain, to prevent things from getting so severe where it's unbearable. And the last one, voxelotor, is used to improve the anemia that accompanies with sickle cell disease. And the next one.
All right, so we've spoken a lot. We've done a lot of talking. What is the impact in the daily life of someone who actually has sickle cell? And this disease is close to me, not only because I am of African descent, but also because in my family, I personally have the sickle cell trait, and I also have family members that do have sickle cell disease. And a cousin of mine, Mr. Darren Douglas, was so kind. Unfortunately, he was not able to be here today, but he was so kind as to answer some questions for us. What is the day-to-day life of sickle cell like? So I'm going to share that video with us just now. And while I get that done, okay, here we go. So we're going to hear about what sickle cell is like for someone living with the disease. My cousin, Mr. Darren Douglas, who has a degree in biochemical sciences and is currently living in Canada.
Hello, can you introduce yourself?
My name is Darren Douglas. I'm 32 years of age, and I'm a Jamaican currently living in Canada.
When were you diagnosed with sickle cell disease?
So in Jamaica, sickle cell testing is done at birth, right? So I was diagnosed at birth.
How did you or your loved ones realize something was wrong?
I think I was at a young age because, going to the doctor, more than the usual, and I was hospitalized at a young age too. So I know that something was different, and the fact that I had like intense pain, like excruciating pains, right? And that I had to dress warmly. Yeah.
What was it like growing up with sickle cell disease? Do you think you missed out on a normal childhood?
I wouldn't say I missed out per se. I had a normal childhood, adolescent life. In terms of, if you want to say missed out, in terms of sporting activities, I couldn't do as much as my year group, my peers. So that's the only thing. And I knew within myself that I had a limit, so I knew I couldn't overdo it. So when PE time, or when it was lunch or recess, whichever one you call it over there. I would play with my friends, but after a while I know I had to, cut it short. Say if say lunch or PE was for an hour, I couldn't do the entire hour. I could do like maybe 50 minutes. Or if I even do the entire hour, I would have to pace myself. I couldn't overdo it.
What about adolescence?
When you're in primary school, you're more spoon-fed. But when you reach high school, it's a different scene, responsibilities upon you, and not everyone is as what I call it now, aware of the illness or exposed to it. So not gonna say nothing in terms of teasing, but people will be like, wondering why I couldn't do certain activities. Like even when it was PE time, you would really find me doing swimming. When it was swimming, the swimming section, you would find me doing swimming. And when there are times when I was hospitalized, people would be concerned and wanted to know the reason behind my hospitalization. When I told them that it was sickle cell, everybody was like, huh? What's that? And as we going through high school, doing biology, you learn about different sicknesses, illnesses, and then that's one of the illness that came up. And then, I would be like the quote unquote spokesperson on that topic. So yeah.
What does a crisis entail for you?
Well, I guess it's different from each person with sickle cell, but in general, a crisis is when you have pain, like pain in your joints, right? So it just comes upon you. Well, it depends. Yeah, you have certain triggers. Like sometimes, for some people, it's the weather. Some people, it's stress. Can be another illness. Say like you have an infection, or so normally you just feel this pain most time. For me, when I was younger, I used to feel it in my legs, arms. But as I grow older now, I mainly feel it in my lower back area, right? And it depends. Most times the doctors ask you to rate it, but there are times when it's just 10 out of 10. It's very excruciating pain. We have to take pain medication, and I'm not talking like the regular Panadol or Advil. Mostly you have to get like maybe morphine or one of those stronger painkillers to quell the pain.
Right.
How often do you have to do consultations with your doctor or health professional? What treatment do you receive?
So right now, I think when I was younger, I used to, you have your family doctor or your pediatrician when you're younger, but you have a specialist. So you have your sickle cell doctor. So I was at the sickle cell clinic up by UWI, that's University of the West Indies. So I would go, I think when I was younger, maybe every 4 to 6 months. Currently now, I'm at the red blood cell clinic here at Toronto General Hospital, and the intervals are like usually maybe every 6 months. It depends on your health, your overall quality of life. So I guess the better you are, if you have any illness, being affected by sickle cell, then the longer the interval. So my last consultation with the sickle cell doctor was in August, and my next visit would be, I think it should be in February, but I think they move it up because they want me to do an one of those routine tests. So I think they bring it up earlier. Yeah, but normally it's just 6 months, 4 to 6 months. 6 months for me usually. Okay, so thank God for me, I don't really have like pains every day. Like I have a good spell right now where I haven't had any crisis. But that's true where from time to time you might have either call it mini episodes or minor mini crisis. And normally for me, I have oh God, I can't remember the medication name right now, to be honest. It's is it Cetamol 3 or Panadol 3? One of those painkillers, but the stronger version of them. Right. So like when I was in Jamaica, one of the ones that I usually take was Panadine, right? That's a mixture between Panadol and codeine. And then So it depends on the pain level. So if it's maybe minor, like nothing too intense, excruciating, you take a regular painkiller like a Panadol or a Cetamol or Advil or Tylenol. As it goes up, then you get the stronger painkillers. And then if it's very excruciating, then more likely you have to go to the hospital to get like the bigger pain meds, as I said, morphine and such. But normally just the over-the-counter painkillers when it's minor, and then normally when you do your consultation, the doctor usually prescribe those stronger painkillers, so you could have it just in case you go in a crisis that could, quell the situation from early.
Have you ever faced discrimination in the healthcare practice because they thought you were a pain medication addict?
Yeah, that's true. Most times, and especially living here in Canada, because sickle cell is predominantly African descent, Mediterranean descent, disease. So being a predominantly white country, yes, they're taught it, but they're not exposed to it, right? So when you come in, they will look at you, or even yourself, because you're growing up, so you know the medications, right? Right? And you're saying, hey, I need this. They're looking at you like, huh? No, you're not supposed to. And then, but if you're well versed and stand your ground, then you will get it. But most times here, you get a little resistance. But since I've been joined the red blood cell clinic here, I have a card that I walk with, so I just let them know. But I would say it's more. I would say it's here, but the few times I've been hospitalized, when I ask it, they were, ask, be like a bit surprised, and then when they realize, then they definitely give it to me. Definitely give me the stronger painkillers. But from time to time they do think that, and then especially in a country where where narcotics, the addiction level is so high. So I guess why they're a bit skeptical in giving those type of medication, especially if they're not exposed to sickle cell persons, people with sickle cell, then I even make it worse. When I was in Jamaica, because we're more the population is more aware of sickle cell. When you go in, it's not an issue to start getting that, the stronger pain medication. But from time to time, you will get that little, a little resistance. I won't say it's major, but I guess they're just, with the policies in terms of trans medication. So especially I notice it where, you might be in serious pain, you just got your dose, and then you're still in so much pain, like, can I get my next dose? They make sure I adhere to like, oh, if it's every 4 hours, you're getting it every 4 hours. Yeah.
How does sickle cell disease affect your daily life, if at all?
Eating habits, I still eat the same. I try to eat healthy, but my day-to-day activities, as I said, just like when I was growing up, I can't overdo it. I pace myself for certain activities, even exercising, I can't do as the normal Joe or Jane does. In terms of job, it's kind of a bit tricky because it's not like you don't want your employer to know, but when you're being interviewed, but I've been always advised by my doctors and even the social workers not to, come outright with it, because some people might discriminate the few that knows about the disease. I think I just have a regular. To me, I think I still have a regular adult lifestyle like anyone else. It's just I just have to be aware, what my triggers are. Yeah.
What is dating like with sickle cell disease? Are you more selective? Is it harder?
Well, I don't know what to say. 'Cause I'm not what I call it, the expert. Yes, I might have a few relationships, but it's not. I wasn't like selective, because what the heart wants, the heart wants, right? But in terms of, it didn't reach the stage where you're thinking about having children. But I guess if it reached that stage, then definitely we'd have to get tested to be sure, you know, if that that significant other is a carrier of the sickle cell gene. But in terms of, I haven't really, you know, in terms of discrimination, you know, yes, some people know about it, but, you know, I've been in a relationship where you know about it and they're still as supportive. They might not know the whole intricacies, you know, it might be an eye opener when they, you know, they're with someone with sickle cell, but I guess it's just the same with any other illnesses like diabetes, cancer, you know, but who knows, you know, I guess it just depends on that person characteristics and tolerance of, you know, other being having a, you know, a very deadly illness.
What would you like others to know about sickle cell disease and people living with sickle cell disease?
That we're just normal human beings also, you know. You want to be involved in the everyday activities that everyone are involved in, and not to look down upon or be shunned, or not even that, not to feel sorry for them, because you know most of us are capable. Most of us have our day-to-day lives, you know, going about it same way, and just to just have that support system to know that you know, people around and they understand, and that they shouldn't take it for granted, you know, when we say we're not well, or they should actually believe us, you know, because some of us are very, like even me, I have a very high tolerance of pain, right? So when I'm sick, when I'm saying I'm sick, I'm definitely sick, right? But most time there are times where I'm sick, but I'm not showing it. But yeah, just to understand and just be more tolerant, I should say, and be, you know, yeah, I would say that.
Right. So we've just heard from someone with sickle cell disease what the impact is in their daily lives, how it affects dating, how it affects jobs, how it affects, you know, just regular day-to-day, always in pain. We're going to continue. We're almost finished. We're almost finished. Bear with us. Bear with us. Thank you for staying with us so far. So we're going to continue. Oops. Not really sure what's okay, right? So in conclusion, just to conclude everything that we have done, if you have learned anything from this presentation today, we want you to leave with 5 things. 1, while sickle cell disease does affect persons of African descent more than other race and ethnic groups, it is not only limited to those of African descent. As we mentioned before, those with Middle Eastern heritage, those with Latino heritage are also affected by sickle cell disease. So it's not just a Black disease. It can be prevented by being aware. So I know I have a sickle cell trait. I know I have sickle cell disease. Knowledge is power. Once I know, I can make decisions that can help me, or if I choose to, as my cousin says, follow my heart, I know what I'm getting into. 3, with adequate treatment and a supportive environment, persons with sickle cell disease can and do live a normal life. You know, we don't have to feel sorry for persons living with sickle cell disease. They are not handicapped in any way. They live normal lives and are functioning members of our society. The effects of sickle cell disease in children and in adults include, these are the most severe, chronic pain. Many persons with sickle cell have reported that they feel pain every day, but because of the pain threshold, they've been through it since childhood, you'd never even know that they're suffering through pain at the moment. Stroke, acute chest syndrome, blindness, and other organ damage. And finally, it is not contagious. You do not catch sickle cell disease by touching someone. However, it is passed on through the genealogical line. If both parents have the sickle cell trait, children can be born, because as we say, the gene pool is a strange place. You never know what can happen. However, there is a very high chance of children being born with sickle cell disease if both parents have the trait, or we have one parent with the sickle cell disease and another with the trait. If someone has sickle cell disease and they they choose to pair with someone who does not have the trait, the children will not and will never have sickle cell disease. So just that we know, we need to know what our statuses are so that we can make the best decision. In conclusion, right now, my colleague is going to place a post-evaluation in the chat. This one we really want you guys to help us with. Not everyone was able to do the first one, but if you could do the second one, this would help us out a lot. What have you learned? Based on what we have said, what have you learned? The link is in the chat right now, I assume. Right, the link is in the chat right now. Please get your phones, get your laptops, get your tablets, do the post-evaluation. What have you learned? How have your attitudes changed towards sickle cell? Maybe are you more open or do you know more? Are you now willing, based on the fact that you know now the complications of the disease, are you now willing to go and get tested to make sure you know what your sickle cell status is so that you can make the best decisions? Remember, knowledge is power. We're going to give you guys 2 minutes to do that, just to know. And as well, at the end of the presentation, there's a tiny little bar. Please, if you have learned something, if you have enjoyed the presentation, do not hesitate to let us know. Tell us how well we did, or if you don't agree, you thought that we needed to do something different, put that as well. But we really, really need you guys to do that post-evaluation for us. And as we said before, as soon as you're finished, please post done in the chat so that we know round about how many persons have completed the chat. So we're going to give you 3 minutes to do that just now. Remember, as soon as you're finished, please place done in the chat so we know how many of you have finished. We really, really need this, everyone. So thanks so much for your support so far, but we really, really need this post-eval. So please tell us how much you have learned. If you have learned more, if you knew all of this before, let us know so that we can get all the responses that we need to get. The link is in the chat right now, so you can click it and you'll be able to know what questions we're asking. Thank you, Dielka. Just once more for anyone who may not have heard, there is a link for the post-evaluation in the group. I know that you guys are all here to support us, so support us once more by doing that evaluation for us. It's extremely important to know the impact that we may have had or may not have had, hopefully we have had, on your afternoon and on your knowledge base about sickle cell disease so far. And as I mentioned before, there is a little bar that tells us, you know, whether you enjoyed the presentation, whether you learned. If you have a great comment for us, you know, exams are coming up, wish us well, I don't know. Let us know how you felt about the presentation. Okay, yes, we'll send the link again, Kanisha. Thank you, Mrs. Valentine. Thank you, Mrs. Logan. Nice to see you. Okay, if anyone has not gotten the link, we'll send it once more. As soon as you're finished, please, we really need your participation for the post eval. Please do it and send it in the group, in the chat, send done in the chat. Thank you, Mr. Ellis, appreciate it. JP, if you have a question, we will answer questions in a sec. We just want to make sure that everyone has done the pre-eval. If it's about the form, however, you can put the question in the chat. Thank you, Mrs. Wilson. Appreciate it. Okay, while you continue to do the post-eval, we are going to accept just a few questions right now. Anyone who has questions, I saw JP, he raised his hand. If you have a question, now is the time to say so. JP, I'm not sure if it's a question about the topic or it's a question about the form. Okay, I guess his question got answered. Okay, I assume there are no questions then. If anyone has questions, can let us know. If not, we are going to end the presentation at this moment. Okay, in order to end, we must say that sickle cell disease is a very in-depth disease. We could have said so much more, but there wouldn't be enough time. If you need additional resources, these are the places that you can go to, you can call, you can send an email. If you're in Jamaica, the sickle cell unit at the University of the West Indies, the number is there. Call, ask all the questions you need. If you need support, if you need treatment, if you need just to get tested for the trait or sickle cell disease, you can go there. If you're from Curacao, the Curacao Biomedical and Health Research Institute in Willemstad, the number and the email is there. Haiti, I won't try to pronounce that, but the number is there as well. And in the United States, Sickle Cell Disease Association of America, and it is right there. The numbers and the contact information is right there. Thank you so much for coming. We have one last favor as you continue doing the post-evaluation. If everyone could just turn their cameras on right now so we can just do a quick screenshot. Thank you so much for coming. We're just gonna go quickly, a screenshot, bam, 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 bam. If you could turn on your cameras just in this second, let's do a screenshot of everyone. We thank you for being with us, being present for the entire time. We appreciate it. We thank you. Oh, Ms. Risden, meanwhile, everyone is turning on their screen. Ms. Risden asked, do persons with the trait display symptoms? Some persons with the trait, while it is not very common, some persons with the trait do experience a bit of pain, for example, when it's cold, but it's nothing in comparison to actual sickle cell disease. So while persons with a sickle cell trait usually do not present symptoms, there are cases of very, very mild pain, very mild molestation. Okay, thank you so much. While we continue, we're gonna, okay, let's take the screenshot here. Thank you. Thank you, Ms. Brutus. Let's take a screenshot here. Okay. All right, thank you everyone so much. And we'll see you on the flip side. We'll see you at graduation, hopefully in the next few years. Thanks for coming. See you later. Bye-bye.